Okay, guys, good morning. 8:39, the time they talk on top of one family entertainment channel. And I won't believe say from every part of Nigeria they watch us from. This time, I suppose they show on top your own channel. What a day today alive. What a day. I know today grateful to talk about health and everything we guys know as regards to your health. My name is Timothy, and I welcome on top of the show again this morning. Of course, we do something new, something special. I bless you, Dr. Bass. Okay, let's take a break from coronavirus. In as much as we know, say it's today town. I mean, yesterday I've been watching a news channel where it talks say another variant's been come out, and they be using the word deadly from Delta. Okay, but whether Dr. go feel breathe in or breathe out of that this morning, only time we tell. But ladies and gentlemen, join me as I welcome my doctor that is always looking fresh, always looking young, and this time
Slimmest.
Came in a Chelsea color.
Slimmest, yes.
Doctor!
Good morning.
Good morning, sir.
Nice to be back on Health Matta.
You know,
Yeah,
you look
morning.
good, doctor.
I'm actually a diehard Chelsea fan.
Oh, nice. See.
Yes, sir.
So, and then the color
Unrepentant
looks
one.
very good on screen. Yeah.
Thank you very much. You look nice too.
Thank you.
As always. Slimmest of them all.
Doctor!
I
Good
like
to have
that.
you. Thank you,
thank
sir.
you. And it's on that note, I want to say a very good morning to you all, our viewers in Nigeria and around the world. We're happy to be back today on Health Matter after a bit of a long break. It is well.
Yeah.
But we are back, we are back. That's the most important thing. Today we'll be looking at malaria. She also mentioned COVID. They are somehow interconnected.
Okay.
Because I tell you, according to WHO figures, every 2 minutes, a child dies of malaria. That means in 30 minutes, 15 children would have been dead. In 1 hour, 30 children would have been dead. Okay, so malaria is what we'll be discussing today. Malaria vaccine in the face of COVID-19 pandemic. Okay, as a matter of fact, malaria kills more in Africa than COVID. Okay,
Yes,
so
correct.
in as much as we've been talking about COVID, we also need not to lose sight of the fact that we have another bystander that is even doing deadlier things in our backyard, in our homes, and of course, that is malaria. And we'll be looking at that this morning. What is malaria? Malaria, we all know in this part of the world. There is nobody that does not have an idea of what malaria is all about. Malaria is a life-threatening disease that is caused by a group of parasites known as Plasmodium. Okay, there are about 5 of them that can cause disease in man, and they are transmitted by infected female Anopheles mosquito. Mark that word. They are transmitted to humans, to people, through by infected female Anopheles mosquitoes. That means that it may not be all the Anopheles mosquitoes that will have the capacity to transmit
But
malaria.
the ones that are
Infected. And of course, not the males, or the females. We will come to that. Now, that was on a lighter note. Now, there are about 5 of those parasite species that can cause disease in humans. Okay? Plasmodium falciparum is the deadliest of them all. Okay, next to it is Plasmodium vivax, Plasmodium ovale, and of course, Plasmodium knowlesi. Okay, so these 5 groups of parasites can cause disease in humans. Plasmodium falciparum is actually responsible for 99.7% of malaria cases in WHO African sub-region. 99.7%. Okay? There are other regions, WHO regions, that are equally as affected as African sub-region. Okay? Southeast Asia region has about 50% of this P. falciparum causing infection in that part of the world. 71% of cases. It is also responsible for 71% of cases in Eastern Mediterranean. And of course, equally responsible for 65% of cases in Western Pacific. Okay? P. vivax, on the other hand, is the second deadliest of the parasites, and it is responsible for, it represents about 75% of malaria cases in WHO region of Americas. Okay. Now, how is this disease transmitted? What are the symptoms? How can the diagnosis be made? Okay. These are some of the subtopics that we'll be looking at this morning. But first, let's look at some key facts from WHO. Okay? In 2019, that was the last time, according to the latest World Malaria Report, in 2019, about 229 million cases, estimated 229 million cases were recorded worldwide, talking about malaria infection, and it caused 409,000 deaths across the globe. And 94% of those cases and deaths happened in our region, WHO African sub-region. And of course, Nigeria is one of the countries that are worst hit. Okay? It will also be important for me to mention that children under 5 years of age are the most affected population group in Africa. And of course, they accounted for 67% of all deaths that happened in 2019. That means about 274,000 children died as a result of malaria, okay, in 2019. It will also be nice for me to point out that the funding for malaria has actually not met what it ought to be. In 2019, for instance, the expected funding was meant to be about $5 billion US. Okay? But at the end of the day, what was realizable was about $3 billion US. And the endemic countries, governments of endemic countries of the world contributed only about 900 million of this amount. And that of course, represents about 31% of funding. So there's this persisting funding gap when you talk about funding of malaria programs, vector control programs that can actually bring about the control and elimination of this malaria parasite. What are the symptoms of malaria? We know a lot of symptoms of malaria in this part of the world. Sometimes patients walk into the consulting room. What they to tell the doctor, when malaria. The doctor greets the patient and welcomes the patient, the next question is, "Doctor, I have malaria and typhoid." You didn't add the brother.
And that's true.
Malaria and typhoid. Usually when you tell me such, I'll tell you, okay, I've had. Okay, but let's go to the symptoms. What makes you think you have malaria and typhoid? And oftentimes, almost everybody will get the symptoms right, okay? So it comes with a feeling of unwellness, a feeling of unwell, otherwise known as malaise. It comes with headache. It comes with fever. Sometimes it could come with gastrointestinal symptoms, nausea, vomiting, abdominal cramps, and sometimes stooling. Okay, but severe cases may affect and damage a number of organs in the human body. Okay, in severe cases too, children may come down with anemia. Children may come down with cerebral malaria, the ones that can actually make a child to become unconscious. In severe cases, it can cause multi-organ damage. And oftentimes, if not treated timely, it could lead to death. Such an individual could die. Okay, so who is at risk? Everybody that lives in a malaria endemic region is at risk. But some people are known to be at a considerably higher risk than the others. And this group of people include children that are under 5 years of age, pregnant women, non-immune migrants that are coming into malaria endemic region, people who have not been exposed to malaria before in their lifetime, they are at risk. Also, travelers, okay, that are coming from a region where this malaria is not strongly, where you don't have malaria, okay, moving to a place where you have,
yes.
of course, that can also, those set of people are also exposed higher than the rest of the others in the population. Now, why are children under 5 usually a lot more exposed than others? The truth of the matter is that because people who live in a malaria endemic region, over time, because of the frequent exposure to malaria, they get bitten by mosquitoes. Oftentimes, they end up coming down with the disease. Over time, they will develop what is known as partial immunity. Okay, and sometimes the malaria could hit them and they may not be able to have the disease. So over time, they will develop partial immunity. So they could have malaria but may not show any symptoms. Okay, but children don't have the opportunity of having been exposed for a long length of time as adults. So as a result, they are usually worst affected. Now, let's talk about transmission. Okay, I've said at the beginning that transmission is usually through mosquito bites. Okay, the mosquitoes are the ones that carry those Plasmodium species or malaria vectors, if you like. Okay, and then when they bite, when the infected female Anopheles mosquito bites an individual, the person could become sick as a result of such exposure. Suffice also to say that there are over 400 different species of Anopheles mosquitoes. Okay, but only about 30 of them are vectors of major importance when it comes to transmission of malaria. It will also be nice for me to point out at this time that it is not only through mosquito bites that an individual can get infected with malaria. An individual could get infected with malaria through some other routes, which of course include blood transfusion, organ transplant. Okay, there is also an important one I think I would like to mention. Okay, women that are pregnant can infect their unborn baby with malaria in what is known as vertical transmission, mother to child transmission. Okay, so that can equally happen in some cases. Okay, and that is why it is important. WHO has recommended that pregnant women should have at least 3 intermittent prevention treatment, IPT, 3 courses of IPT in the course of their pregnancy, usually after the first trimester of pregnancy. Okay, so that is the WHO recommendation. They should have at least 3. And the drugs that are commonly used is what we refer to as SP for short. Okay, sulfadozine pyrimethamine is a common drug that we all know, but I do not want to mention the brand name because of restrictions. Okay, but it's a common drug. It usually comes in 3 tablets, and you swallow that 3 tablets at once. Okay, so I'm sure you must have taken a drug like that.
Who hasn't?
Okay, so that is used, okay, to prevent pregnant women from having malaria and, of course, from transmitting the same to their unborn children. Okay. Now,
okay. They say we should hold you up a bit so that you'll feel good drink water. I know my doctor is back and fresh, so he's got a lot to deliver this morning. So, guys, we open the phone lines from any part of the world where they watch us from this morning. You get questions, you get contributions. As a matter of fact, you are affected by what they talk about this morning, because malaria and I'll call them general sickness. You know, just like what Dr. Barth talks, say you enter hospital even before doctor asks you. The first thing you talk about is, I have malaria. Okay, so if you know you have questions, you're easily prone to malaria, you want to know why, please feel free to call those numbers on your screen, 081-054-34984 and for 081-73-147589. I wish I could go back to all of the things the doctor don't talk about, but time no go permit us, because even me personally, I get my questions already. I don't write like 5. But I don't go there stingy, so I go just take my time to ask them one after each after one. Now, first off, doctor, the first thing I've been right, because it is saddening my heart to hear say na Africa na they more hit by malaria, and the only thing where they come to my mind now, okay, fine, Slimy, waiting for they responsible. She our color na they responsible ni, or na the weather for Africa now they make us this hit with malaria? Or is it that, I don't know, doctor, really, why is Africa worst hit by malaria?
Thank you very much.
No, seriously, maybe I want to just know whether na color thing.
Thank you very much. Thank you very much. Now, to answer that question, let me quickly say that there are a number of factors that can actually be responsible for the intensity and degree of transmission when we are talking about malaria. We'll come back. We'll have Chizoba from Taraba.
Those are coming.
Chizoba, good morning.
Hello, good morning.
Hi, good morning, Chizoba.
Yeah.
Please go on with your question.
All right. Which malaria drug? Can you hear me?
Yes,
you can hear you loud and clear.
Which malaria drug you take when you're pregnant?
Thank you very much. She wants to know what type of drug is safe for a pregnant woman. Of course, by extension, breastfeeding woman. That drug is called SP for short. Sulfadozine pyrimethamine is very safe in pregnancy. I may not be able to mention the brand name. If I do, you will know the drug exactly. But that drug that you can take 3 at once. 3 at once, and that will be all. That is the drug that is usually recommended for intermittent preventive treatment. Okay, for malaria, we usually give such drugs to pregnant women. But that will depend on the trimester that they are. Okay, first trimester, the drug is not given. So you still, just like you rightly pointed out, you still need to see your doctor. The prescription must come from the doctor so that you don't go on self-prescription and run into troubles. Thank you very much. Now, back to your question, Slimmy.
Yes, sir.
What could be responsible for the high level of malaria in Africa?
Yes, sir.
And I said the number of factors that are responsible for the intensity of the transmission of malaria. Okay? Some of these factors can actually be responsible. One is, number one, is the vector, the species of the vector. A while ago at the beginning, we pointed out that P. falciparum is most virulent of them all, and it is what we have in this part of the world. Okay, so the species is important, determines the degree of affectation a community will have. P. falciparum is responsible for 99.7% of all malaria cases in Africa. Okay, that's one. Number two is the host factor. Some people get bitten and they do not fall sick. If it's people who have been exposed before, like you and I, we may not fall sick when we get bitten. Unlike a migrant, okay, a visitor that is coming from US that hasn't visited Africa, okay, malaria endemic region in his or her lifetime before, the person could come off worse if such a person gets bitten. And of course, the environment. When we talk about the environment, we will be looking at climatic factors, okay? They can be responsible. Now, another thing I want to quickly add is the fact that the climate we have in this part of the world has actually made it possible for the it has actually made it in some parts of the world where you have temperate regions. Okay, so the lifespan of mosquitoes could be cut short in that parts of the world. But the climate here allows the mosquitoes to enjoy a very long lifespan. And as a result of that, the parasites will have all the time to multiply in their system and reproduce and then get pushed out in large numbers. Another one is what I want to read out.
Okay.
The strong human biting habit of the African vector species. The strong human biting habit. The ones in this part of the world are wicked. Instead of biting some other animals. Okay? So they have strong affinity for humans. And they bite humans much more than the other animals. Okay, so that is some of the reasons why we have it more in this part of the world. Do not forget that it is not all parts of the world that mosquitoes can thrive. In temperate regions, places that are very cold, they do not survive. So our climate, majorly. And of course, it could also be seasonal. Okay?
Like
during the rainy season, yes, they usually breed more. And immediately after the rainy season as well, because you have pockets of water accumulating, sometimes potholes that are not filled up on the road, bushes around our stagnant waters around our homes, and a number of other places. So they serve as breeding grounds for these mosquitoes, okay, that will harbor these parasites in their system, okay. So they eventually will keep multiplying and that is why vector control is key if you want to eliminate malaria from any environment. And when we talk about vector control, we are looking at two major things, actually. The use of ITN, insecticides treated mosquito nets. We have Ikechukwu from my home state, Anambra. Ikechukwu, how are you today?
I'm very fine, thank you. And you?
I'm good.
That sounds like
How is Anambra State?
Anambra is okay. Anambra is okay.
Thank you very much.
Okay, so you get a question for doctor.
Yes, I have a question for her, for the doctor.
All right, please
Go
go
ahead.
on.
Anambra is okay. I really appreciate this program.
Thank you very much.
Yes, you people are really doing, yes.
Thank you.
Thank you.
Question now is, at first trimester of pregnancy, what drugs should a pregnant woman take?
Thank you very much. Yes, thank you very much. There are a number of drugs that a pregnant woman can take in the first trimester of pregnancy. Okay, surely not the SP that I spoke about a while ago. A pregnant woman in first trimester of pregnancy can safely, very safely, take a drug called amodiaquine. Again, I'm not going to mention any of brand names because of restrictions. Amodiaquine. The dose, okay, I don't think there's any need to point out, but it's a drug that you can take 3 today, 3 tomorrow, and 3 the next day. Okay, so you can have an idea. Okay, so that's the usual dose. A pregnant woman can comfortably take that at the first trimester. And of course, first trimester is talking about the first 13 weeks of pregnancy. Okay, so it's after second trimester that we can give the one you take only 3 at once and you're good to go. And that's called SP, sulfadosine pyrimethamine. Okay, thank you very much.
All right, doctor, since they talk about children, pregnancy and all that, now make her ask, I wonder whether na fact or not just me say malaria, they affect children more than adults. Now, if that is the case, if that's they proven, why is it like that? Is it because, first off, they small, their immune system never they well? Yes. I don't know. But what's actually responsible for that? Of
course, we call them children, and specifically we said under 5s. At 5 years, such a child or such an individual may not have been adequately, in quote, exposed to malaria, just like you have in an adult who may be 15, who may be, or individuals who may be 15, 20, 25, and 30, they must have seen it all in terms of getting bitten by infected female Anopheles mosquitoes. So they develop partial immunity. So oftentimes they get bitten, they could have malaria, but no symptoms. So you also have asymptomatic infected people. Not carriers.
Malaria too.
Of malaria too. Okay, so because children are not as exposed as adults because of their limited number of years that they've been on Earth, that is what is responsible, at least in this part of the world. Okay, so when they become adults and they get out, the frequency may also reduce. Additional thing is that some people with certain blood groups have been found out. Because
I actually wrote
to be a lot more prone.
I'll be right now,
a lot more prone than others.
They say, no, that's your sickness. And I'm like, why does it have to be our sickness? Why does it have to be malaria?
Now, I also would like to point out that just like we watched in that video a while ago, COVID-19 pandemic has disrupted a whole lot of things. At a time, nobody remembers anything about malaria. There was a time from year 2000 to 2020, these 2 decades was actually regarded as a golden era. Giant strides were made in terms of control and elimination of malaria globally, on a global scale. But all of that have stalled now. Prior to even the advent of COVID, all of that have stalled now. Okay, some countries of the world are even going higher and higher. And as a result, suffice also to mention that we're in the days of vaccine. Okay, a number of vaccine trials have been ongoing for malaria before COVID came. And as we speak, the good news is that since 2 years ago, when the first pilot program with malaria vaccination started, it actually started in 3 countries in Africa. Kenya, Ghana, our neighbor, and Malawi. Okay, so these 3 countries, in Africa started adding malaria vaccination to their routine immunization. And as of this moment, they've been able to immunize about 650,000 children. And this malaria vaccine, called RTSS, comes in 4 dose regimen.
Okay.
A child must have at least 4 doses. Okay, it has been found out to be about 55% efficacious. Okay, so meaning that it could prevent 4 in 10 cases of malaria. But just about a few months ago, a major breaking news had it that AstraZeneca and Oxford University, responsible for the COVID-19 vaccine that we are currently taking in Nigeria, they were actually working on malaria vaccine for a long time. But the challenge is that, according to a professor that talked about it, he said that malaria has about over 1,000 genes, unlike COVID that has about 10 to 12 dozens of genes. So it is difficult getting a malaria vaccine, but only recently there was a breakthrough. They were able to get a vaccine that has been named R21 matrix M, and it has shown 77% efficacy. Okay, it has been tried in Burkina Faso. About 450 children were part of the trial. At the moment, a larger group trial is ongoing with over 5,000 children, and this is going to be a game changer when it comes to vaccination, when it comes to malaria vaccination in this part of the world. Okay, so that was a major breakthrough, and it happened just a few months ago. But before that time, the only approved vaccine for malaria has been the one from WHO with our partners. That is the one that is currently undergoing, that are being used for pilot scheme in 3 countries of African continent I mentioned a while ago. And of course, they've been getting good results. They've been getting good results.
Okay, well, doctor, now with all of these things where you talk like this now, is it possible, can malaria ever be eradicated from Africa? Like, do you see that happening? I don't know.
Yes, there's actually a medical term, malaria elimination and malaria eradication. These are actually medical entities.
Okay.
Yes, we can, and it has been done in some parts of the world, but it will require a strong commitment from our policymakers, from our governments, from our leadership. They need to show strong commitment. We need to strengthen our surveillance system, okay? The surveillance system in the sense that we need to invest in tracking and then assembling data that can be used to make key policy decisions, okay, when it comes to vector control in large scale, okay? So the commitment has to come from them. At the moment, going by the 2019 records we have, out of the 3 billion in funding, total funding globally for malaria, the endemic countries of the world, majorly in Africa, they were only able to raise 900 million. That's not good enough. About 31% of the total funding. Okay, so we have an adage that says that somebody who wants to go and defecate will have to be in the forefront. As
a matter of fact, just see the theme of this year's World Malaria Day. Dr. Yes. Call my attention to that. And I wish that this will become a challenge. You know, #0malaria starts with me. You know, because at the end of the day, in our teamwork, we all guys come together to fight this. Okay, so Doctor...
the communities, just like that Dr. echoed there, the communities need to own the response.
Yep.
Very key. The states need to own the response. The nations of the world, particularly in Africa, we need to own the response, okay? And it's on that note that I want to hit the prevention button, okay? Now, vector control is key in preventing or interrupting the transmission of malaria. I must point that out, okay? And majorly, there are 2 major ways that vector transmission have been done over the years. One is ITN, the use of insecticides-treated mosquito nets. Okay? A lot of us do not regard it. I can tell you that it's one of the effective ways of combating the spread of malaria in our communities. Now, it can do 2 things for you.
Okay.
It provides a physical barrier that will make the mosquitoes unable to reach you and reach your children and your family and loved ones. And also, it contains, it has insecticides impregnated on the net itself. So it has insecticidal effect. It has the capacity and potential to kill any mosquitoes that perches on it. Okay, so if you have wide use of ITN in a number of communities, it can help to prevent and cut down on the transmission. Blessing from Abia. Blessing, good morning.
Good morning, doctor.
Yeah. How are you today?
Yes, I'm fine, doctor.
Yeah.
Thank you for this topic you are having this morning. In fact, this is my first time.
Oh,
Yeah.
thank you, Blessing.
Thank you very much for having us, for joining us.
Abby.
Thank you very much.
Yeah.
I just heard about this topic and I'm interested because this is just exactly one week I've been diagnosed of malaria. Just in fact, just 2 times. But I've been given malaria tablet, but still I'm still down. I don't know what is the problem.
Yes, thank you very much. Because we'll be able to say 1 or 2 things on treatment. This takes me to drug resistance in the treatment of malaria. Okay, so if you've been treated and you're not yet well, please, I will advise that you return to your doctor so that they could probably change the medications you were placed on and probably add some other things. But let me also point out, because I've mentioned 2 drugs earlier in this presentation, that the mainstay of treatment for malaria is ACT, artemisinin combination therapy. Artemisinin is gotten from a plant, okay, that are found in Chinese and some other parts of the world. I was told by someone that it is now being planted in Nigeria, Artemisia annua. Okay, so that's where artemisinin is taken from. It was a Chinese plant. Okay, so ACT, artemisinin, that's a major drug component there. In combination with about 4 other drugs, therapy. So what is used today is no longer those single therapy, 1 drug monotherapy that will have been used in time past because of resistance, challenges of resistance. Okay, so that is why today the mainstay of treatment has shifted to ACT. Thank you very much for calling in. Now, I've mentioned ITN, insecticide-treated net. The second one is IRS, indoor residual spray. Okay. It can be done once or twice in a year. Okay, so just like fumigation, they will come into your house and fumigate within the inside of your houses and compounds and everything. That can help to cut down on malaria transmission. But unfortunately, there are challenges with this second part of vector control. Okay. As a matter of fact, WHO has documented resistance to this vector, to this. Ibrahim from Taraba. Good morning, Ibrahim.
Good morning, sir.
How are you today?
Fine, sir.
Thank you very much.
Please go on. Do you have questions? Ibrahim.
My question is that I said that what is the issue? What is the essence of the malaria medicine they wanted to call the name?
I had him. He said, "What's the name of the other medicine that I think he said I didn't call the name." You know what? Call me after the show. It was deliberate.
It was deliberate.
You can call me. I think the technical team will give my number.
Yes, you will see his number.
So give me a call after the show. We can talk more on that.
Yes, see, that's Dr. Barth's number. Don't call him now. Please call him after the show. So if you want it, maybe we'll tell you.
That's also my IG handle, so you can reach me.
Yes.
Okay, so the second one is the IRS. Now, the major component that is used in IRS, indoor residual spray, is a compound called pyrethroid. Okay, so mosquitoes have started developing resistance to that. In fact, it's the latest malaria report that was released about 2 years ago, April 2019, actually pointed out that about 73 countries of the world have reported resistance to that. And then 28 countries have reported about resistance to all 4 components that are used in that. Okay, so I think we'll
continue. That was what I asked. We'll definitely continue for me again next week.
This is how much our time will allow us. But please,
The show continues next week, Saturday.
Join us next
about
week.
malaria vaccine, and COVID-19.
Because it kills more than
COVID.
At
Yes.
least in Africa.
Yes, so please.
So see you next week.
Let's be deliberate about the fight against
sir.
malaria. We'll see you guys next week, Saturday. But I'll see you on top 5. 1, 2, 3.
Yes, so.
And
And zero malaria.
Zero malaria. Start with me.
With me.
Hashtag. Yes.
Yes,
Bye.
thank you very much.